PRP, also known as platelet-rich plasma therapy, as you said, is basically an adjunct or an additional thing that we use to aid in wound healing. Basically, what it is it's you take the patient's own blood, you spin the blood down in a centrifuge in order to isolate out the red blood cells from the platelets. You then take the platelets and essentially use them either as a gelatin, kind of like a jelly bean, or as a spray to augment the surgery that you're doing and aid in wound healing.
And how long has this therapy been around?
The therapy for PRP has been around for approximately 20 years. It started out for use primarily in plastic surgery and maxillofacial area surgery, where they were using it with soft tissue wounds. In orthopedic surgery, it's only really been within the last 5 years or so that it's been used at all, and only in the last couple where it's really started gaining popularity.
And now what kind of injuries is PRP used for?
PRP tends to be used as an aid in addition to other therapies very frequently in areas where you're worried about wound healing and not enough blood flow. Areas that it's been used for is certain muscle injuries in the leg, tennis elbow, soft tissue ruptures of either the patellar tendon or the quad tendon down by the knee, Achilles tendon ruptures. It's also used in addition with knee surgery when you're trying to fix the meniscus, which is one of the structures in the knee. And then also in shoulder surgery, it's occasionally used to aid in rotator cuff surgery. Basically, any type of situation where you're doing a surgery or you're worried about an injury not healing appropriately, you can add the PRP therapy to try and help in the healing.
Can you talk a little bit about the mechanism of how this therapy works?
Essentially, platelets are filled with growth factors and things that have been known to aid in healing and also in the recruitment of other cells in the healing process for quite some time. Whenever people get injured, the first thing that happens is it has an inflammatory response, basically a bleeding process. If you get, that's where bruises come from. Bruises are essentially just bleeding underneath the skin. What the blood does is it has platelets in it, and the platelets release these growth factors, and they also recruit other cells. So they might recruit white blood cells or other cells that aid in the healing process. By doing this, the healing process is sped up. Well, by taking the platelets, isolating them out from a patient's blood, and then injecting them into that area where you're doing the surgery, you're essentially giving the body one extra step to try and heal that wound.
Basically, platelet-rich plasma therapy is a treatment where we take a person's blood, we spin it down on the machine where we can get the platelets out, and then we inject the platelets back into the site where the injury is. Normally we use this for tendons, ligaments, even sometimes joint problems. The Dutch study that was recently published was a very interesting study because it compared a very traditional form of treatment for tennis elbow, which is the tendinitis at the insertion of the tendons on the elbow, a very traditional treatment which was cortisone injection into the area versus platelet-rich plasma injection. And the theory being that although the cortisone injection may help initially, the long-term results in the healing of the tendon will occur much better with the PRP group. The results were exactly as I would have expected. The cortisone group in the first 6 to 8 weeks actually had less pain score and less disability than the PRP group did. However, after about 6 to 8 weeks, the cortisone wore off, and the platelet-rich plasma group did really well from there on out. And by the end point of the study, around 6 months, it had a dramatically improved effect over the cortisone group. Well, the great thing about PRP, especially for athletes who want to get back faster and want to get back stronger than ever before, is that we now have a way to treat them without surgery where we can actually cause a healing of the tendon to occur. So before we would try to treat them and let their pain get better and then kind of get them back to play, but there was a lot of risk of recurrence of injury because the tendon wasn't as strong as it was to begin with, and therefore they may re-injure themselves. So now we have a treatment that actually causes a healing response. At this point, anybody who has a chronic tendon problem that hasn't healed on its own or with traditional treatments would be somebody who could be a candidate for PRP. We may need to order additional tests or do some additional diagnostic studies to make sure that the tendon would respond to the treatment. And we do that all the time. And if you're the right candidate, it's a good treatment for a lot of folks.
Hi, my name is Dr. Alan Mishra, and today we're going to be talking about meniscus tears. And the meniscus is a cushioning cartilage that occurs inside your knee between the femur bone and the tibia bone. It's a little rubbery substance that helps cushion your knee. There are two types of cartilage in your knee. One is the surface or articular cartilage, and the other is the meniscus cartilage. Meniscus injuries usually occur with some sort of twisting injury to your knee, typically with like basketball, soccer, or skiing. If you do tear your cartilage in your knee, what you may feel initially is a little swelling in your knee. You might also feel a pop at the time of the injury. That's one way to injure it. The other way to injure it is with a degeneration of that, which occurs over a long period of time. You play tennis for a long time, or you're swimming and you do breaststroke, and you can have some chronic pain that can result in a tear. Either way, if you have persistent pain, especially on the inside or outside part of your knee, you should seek attention. I recommend you see an orthopedic surgeon to evaluate you, and he or she will look at your knee, see how swollen it is, and determine whether or not you need further studies based on the physical exam. If you have catching or locking of your knee, it becomes more important to do something sooner than later. Most injuries to the meniscus, especially in younger people, require surgery. And if you do end up with surgery, it's almost always arthroscopic, which means small incisions and instruments about the size of my pen. Almost always also that's outpatient. The recovery from that type of surgery depends on what you do. You can either resect it, which means to partially remove it if it's very badly torn, or you can try to repair it with suture or other type of devices to restore the full integrity of the meniscus. Afterwards, the time it takes to recover depends a little bit upon what was done at the time of the surgery. If it's a removal or a resection, you're back to doing most activities within a couple months. If you repair it, it's anywhere between 4 and 6 months afterwards that you get full release to activities as tolerated. Prevention of meniscus injuries is important, and you can help avoid not just meniscus injuries but other injuries by maintaining strength, balance, and coordination of your knee through a specific exercise program, which we'll talk about in another video. So thank you for listening. Any further questions or concerns can best be answered by looking at our website. That's emedx.com, which you'll see at the end of this page.
Dr. Sampson, what is platelet-rich plasma, or PRP?
Platelet-rich plasma is an innovative new procedure where we maximize the body's natural healing response by drawing blood from the patient's arm, concentrating their natural healing properties called platelets, which release growth factor, and then re-injecting them into an area of injury to promote healing and regeneration.
How did you learn about platelet-rich plasma?
I initially learned about platelet-rich plasma therapy from a former colleague who was a renowned orthopedic knee surgeon. And this surgeon had told me about a procedure being done on European elite soccer athletes. And what he had reported was some phenomenal recovery where athletes were having injuries and accelerating their return to play with no reported complications. So initially, the light went on for me in my young practice that there was something here. And it was all in tune with what I believe, and that the body has a natural ability to heal itself, and we're just kickstarting healing using cutting-edge new technology. So I got immersed in the technology, and I did a comprehensive review and published it, looking at all the data, all the studies from European journals and various physicians, and really got enthusiastic about this process and started creating some research on my own.
When did you start doing PRP injections, and how many have you done?
I started PRP therapy approximately 3 years ago, and since that time we've done hundreds of injections. Initially we began treating tendons and ligaments for isolated cases like tennis elbow, and then through time we developed protocols in treating knee arthritis and other issues.
What types of patients are good candidates for PRP? Well,
we look at PRP therapy as helping two subsets of patients. One, we look at patients with new injuries, for example, someone who recently tears their meniscus, or secondly, people that have chronic non-healing injuries. So we treat both tendon and ligament injuries. Tendons basically connect muscle to bone, and ligaments connect bone to bone, much like the Achilles tendon or the tennis elbow. And then we also treat patients with cartilage injuries like knee and hip osteoarthritis.
Are you conducting research?
We're doing many studies currently at our practice. I did a pilot study on 14 patients with knee osteoarthritis that all failed all the standard treatment, including cortisone injection, physical therapy, anti-inflammatory, bracing, acupuncture, knee arthroscopy, which is a knee surgery where they clean up the knee. And we found that of these 14 patients, we're publishing the data sometime this year, that about 60% of these patients had continual functional benefit. And so this is really exciting because these were all patients that really failed standard treatment and had no options other than a second surgery or a more drastic procedure with potential side effects. And some of these patients did really well. And what we found in some of the cases, there's some dramatic benefits. Additionally, there's some case studies we're working on and various projects collaborating with other doctors around the country and even internationally potentially.